So, guys, do you believe that any disease can be cured with supplements, with herbs and vitamins, or you're more on the side of traditional or Western medicine? Okay, this is Queens with Accents, and I'm your host Natasha, and this is my co-host Nadia. Nadia, say hi.
Hi.
And today we have a third co-host. Her name is Tatiana. Tatiana, say hi and introduce yourself, please.
Hello, my name is Tatiana Fox, and I'm very happy to join you, ladies, to discuss this topic today. I'm a licensed in state of Florida acupuncture physician, and I'm a national board certified physician in oriental medicine, and I am a practicing physician. So I do acupuncture, herbs, homeopathy, and everything in between.
Oh, that's so cool, and I'm sure we're gonna have a lot of questions for you and a lot of to discuss today. I love everything that comes to girls. Please correct me in terms because I'm tend to say traditional or non-traditional holistic medicine, but you telling me that's not what it's called. The herbal medicine. What do you call this?
There's different things, okay? And you also, like, when we were discussing this subject, you also kept saying holistic medicine.
Yeah.
Holistic medicine is not always only specifically Eastern medicine or Western medicine. Holistic means whole, as in everything. So you could be using different modalities for healing, right? It's not necessarily only one thing or the other thing. It's not an absolute term. Whereas if we're talking about Western medicine usually does not necessarily accept all of the modalities of, and again, depending on the practitioner too, right? Depending on who's doing what. But Western medicine usually does not accept all of the herbal stuff and all of the additional complementary medicine. That's what it's called. It's called CAM also, complementary and alternative medicine. We actually took a class in school for that.
So alternative would be the word, right?
CAM?
Alternative would be the word, right?
Could be. It could be, yes.
Okay. Okay, because I'm confused now.
No, right now she's more confused.
What do you call what you do, Tatiana? What do you call your type of practice?
I don't. Again, there are very few, very different perspectives to the same subject, and we certainly. Like, we all have the best intentions for for our patients, and alternative medicine is kind of, we try not to use this term anymore because it's kind of belittling our practice, because now the bar has been risen quite high to get into the profession. We have 4 national board exams that are, I would say, quite hard to pass, and we require to have masters in oriental medicine and like thousands of hours in clinical practice just to be allowed to take board exam. Just recently, they have lifted this restriction that you have only 5 attempts per each board exam. And when I was taking them, I was under that pressure. So, like, alternative medicine is quite not applicable. For example, like in Russia, this field is still not regulated, and that's what causing this misunderstanding with translations to like Russian language itself. So here in United States, we generalize it Western and Eastern approach, at least with my socium I interact with, because certainly we don't separate one from another. I use plain science for what I'm doing. So that's why kind of alternative medicine sounds a little bit like diminishing that. Whereas we try to combine the best out of both worlds. So that's my point of view. And that's what I mean saying of holistic approach. Like, yes, we together look at the body as a whole, of its mind, of its spirit, and the body itself, like musculoskeletal and different systems like blood, nervous, central, all these systems, central nervous, I mean lymphatic, all of that, and also approach collecting like the best out of both worlds, Western and Eastern. So that makes a whole.
You know how
That's my view.
remember how before it was acceptable?
Oi.
Oh, look at that.
Yes, it's my emotional support animal.
That's
Oh
a
my
good
God, you
helper.
cat mamas, you cat mamas.
But I was gonna say, Natasha, do you remember when there was a time when it was widely accepted to call Asian people Oriental, and then
Mm-hmm.
it was not a politically correct word anymore, right?
Mm-hmm. Mm-hmm.
So it all
You
changed
mean in America? No, no,
in
not
America,
anywhere else. Yes,
right?
yes.
Right. So
Mm-hmm.
because Oriental used to be people of whoever appeared to be of Asian descent could have been labeled as Oriental, right? And now,
Right.
Mm-hmm.
and this is the same thing with the Eastern medicine, Western medicine, complementary, alternative medicine. It's the same thing. It's the terms that keep changing, and they are, I mean, largely they're semantics.
Mm-hmm.
The what they do or what we do or what everybody, it doesn't change per se very much. What changes is the terms. Like the same thing as for us. Up until like a certain time ago, like physician assistants were called physician assistants. They're not called that anymore. They're called physician
Mm-hmm.
assistants, right? So they changed the term. Both physician
Mm-hmm.
associates and nurse practitioners used to be called mid-level providers. So they're changing that. They're like, oh no, they're not mid-level providers. They're just providers, right?
Mm-hmm.
APPs, advanced practice providers. So it's all like the terms are different, I guess, depending on where you are in time in a timeline, right? But what Tatiana does, for example, doesn't change depending on what you call it, right?
Exactly. Yeah.
Exactly. Yeah, yeah, yeah. The name doesn't really change anything. So you studied Chinese, right? In particular, Chinese medicine, right? And acupuncture.
Yes.
That's particular field. Okay.
Yes.
And you study like Chinese herbs and
Yes,
right?
big time. Chinese herbs is big time, and it's a very strong, powerful instrument that I use. Yes, herbology, especially like materia medica contains more than 1,000 single herbs and over 450 formulas. There is just a basic standard like for national board exam.
But you didn't go to the medical college before that, right? You didn't go. That was your
Um,
first medical
it
field, right?
was I was accepted. It is master's program, so because I have already masters of in technical field, I was an engineer in Russia in telecommunications. So and my diploma was course by course evaluated by a governmental recognized company in
Mm-hmm.
Washington, DC. So they have. Took some subjects like chemistry, physics, some like some of the curriculum, so which allowed them to accept me to that program. So
Mm-hmm.
yes, but technically speaking, yes, it was my first like specifically medical field education, and that what made is very hard for me to study, especially first year when we studied all Western anatomy, physiology, pharmacology, medical terminology. It was insane for me, like
Yeah,
language
that was my
wise.
question, and that was my question for
Yes.
you, in kind of reversed for Nadia, because like you studied more, yeah, you studied anatomy, physiology, and all of that in 1 year probably, right? And but mostly you studied uh, gosh, I'm confusing terms now. Let's say non-traditional medicine. And Nadia is opposite, right? She studied all. Let me use my street the form terms I know. The traditional
Yeah.
side of the medical medicine, and they don't really teach nutritions right now. Our
No, I
John
would
Kennedy,
I would
no.
disagree. We do take nutrition. We don't
Uh
take
huh.
we don't specifically learn herbs. That we don't do, but we do
Okay.
take nutrition. But it's a different thing from herbs. It's not the
Yeah,
same.
but what in nutrition? What
Absolutely.
particular nutrition do you study in medical college?
Is it question to me or to Nadia?
To Nadia, yes.
Okay.
So what the class covers is basically covers vitamins. It covers the main minerals that you need, the basic needs of the body to survive, and the balances that the body needs to survive. But it does not touch upon herbs. There are very few things in art schooling that gives us a little bit of glimpse of herbs, and most of the time it's basically given to us so that we understand the contraindications, so that we can
Mm-hmm.
warn our patients, do not take this if you're taking this medication that I'm prescribing,
This, right.
right?
Mm-hmm.
And it's not, it doesn't really give us a lot of the things of like, okay, well, this herb can do this and this and that. It just basically gives us a brief overview, and don't take it with this. Brief overview, don't take it with that.
Mhm.
But it's not a full course on what the herbs actually can do. And I think this is something that, yes, definitely, if I were given a chance, I would take that class, in a sense that, because I have patients and they come to me and they say, "Can I take this?" And I'm like, "I have no idea what this is."
Mm-hmm.
Right? Like, I don't know.
Yeah, right. Because, well, the common talk is that doctors are not taught nutrition right now. That's what everyone says. It's like
But that's not
it's
true.
not something I say. But in
That's
that John Kennedy, or no, Robert Kennedy. Sorry, Robert Kennedy right now wants to. That's what the people are talking about. That he wants doctor to teach learn nutrition right now. Like, somewhere I probably missing a lot of knowledge in this field, and I hope you're going to fulfill me with that, because I already get some information from you, because that's what people keep talking about. The doctors don't learn nutrition in college. That's why they give only
doctors
the
and medical
medication.
don't learn nutrition in a way to teach nutrition. Like, why do nutritionists exist? So that they can build you a plan, right? So that they can build you a diet. This is why they exist. This is their job. It's a whole totally different field. Medical professionals who prescribe do take nutrition, but not in so much depth as if to be a certified nutritionist, a licensed nutritionist, to build you a diet plan. No, we can give general recommendations because we understand the
Mm-hmm.
general principles, but we are not nutritionists unless you have another degree in nutrition. Then yes.
Mm-hmm. Yeah, but is it, what is going to be your first line of treatment? Is it going to be don't eat, I don't know, meat, eat less sugar, and I don't know, mangoes, or it will be some medication that you will need to take? Which will be the
But
first?
it depends on the degree and the severity of what we're talking about. Say for example, diabetes, right? If a
Right.
person is pre-diabetic, I will not. My first line treatment is not to recommend medication. My first line treatment is to recommend nutrition, exercise, and lifestyle modifications. However, if you're already so diabetic that your blood is literally like syrup, at that point, I'm
Mm-hmm.
sorry, you're getting probably 3 medications from me, right? And also lifestyle modifications, nutrition, and all of that, right? But it's a totally different, thing on the scale. It's not the same for everyone. It's not a cookie cutter thing.
Mm-hmm. And what about you, Tatiana? Like, how would you
I,
recommend if diabetic came to you, for example, and like, help me, Tanya?
I would like to start a little bit before the concrete like case, because
Mm-hmm.
we look at the nutrition in a very different perspective again, because of course I learned a lot from Western point of view, of course, all about nutrients, let's put it this way. But we have a huge like piece of what is called the food therapy. So we look at everything, and what is very unique and specific about Chinese medicine is what it calls herb. It is not herb. It is not just a plant. So Chinese people, like through thousands of years, has collected such a huge number of any substances, starting from stones, shells, insects. It could be anything. We just call it herb because they see good in everything, but also bad. So it is very, very, very individual and unique. And the same as the food. And when you devote so much time and memorizing a lot of things, they kind of sink in you, and then it becomes natural. It just changes your entire perception throughout the years. So now, even if I mm, go to restaurant, I don't place order just because, like, I subconsciously already know, okay, what is outside, how I feel, what I want to achieve, and because of multiple these reasons, I would make my choice. And same with the patient. So for me, number one, I have to come up with my like Chinese medicine, like with a diagnosis. It is different. Sometimes they correlate, sometimes they overlap, sometimes they has nothing to do with one or another. So diabetes would be in the root of it, from my Western or Eastern view, could be like so many different, like patterns that would lead to that. And food plays significant role because we look at it as a therapy. We looked at things just very different. So nutrition, it's more like of a food therapy. So
I have my own experience with Chinese medicine. I went to China many, many years ago. Amazing
mm-hmm,
experience for 4 months. I absolutely loved it. We'll go there again any day. But what it was interesting to me, no matter what we got sick with, and no one got sick with like serious diseases, thank God at that time, but like cold, pink eye, somebody broke their arm, whatever. The
mm-hmm,
Chinese people always suggested drink hot water, drink hot water, whatever we got, drink hot water. That was the common recommendation from Chinese people. But there was a guy with us who had
mm-hmm,
eczema. What do you say,
mm-hmm,
Nadia? And so he went there for that particular reason because no one could cure him in Kazakhstan where I lived at that time. So he went to China for that to cure eczema, and he went to some village. He told us because we didn't know what he was doing, but he came back in 2 weeks without any signs of any rash on their arms. And he said it was absolutely a horrible experience in terms of just physically tolerating it, because they give him drinks that they prepared every morning made of bugs and worms and herbs and like all kind of stuff, and he had to drink it for 2 weeks, and also like use some kind of ointment that also
yeah,
made for him.
topically
It's
applied.
some topical that smelled horribly, but he came back and he had like, what do you do, like it so it doesn't get to you.
Mm-hmm,
um, so he came back without any little spot. It was completely gone, and he
mm-hmm,
didn't drink hot water. It wasn't just his recommendation.
I
So
have
that was an
story.
interesting experience.
You said eczema, and I have a story similar. Eczema in Western medicine is non-curable. It's non-curable. It's controllable, but it's not curable in Western medicine.
Uh-huh.
Same thing with there's another one that it's also like a skin condition, psoriasis, right? Where you get like plaques all over your body.
Or psoriasis. What psoriasis? Not eczema. That's what he had.
Psoriasis.
Yeah, that one.
So I had a patient. He had the huge, like really, really bad experience with psoriasis. His whole body basically was covered in plaques. Obviously, it was extremely uncomfortable. It was horrible, and I sent him to a specialist. I sent him to he had a dermatologist, he had a rheumatologist, and if I'm not mistaken, he also had an allergist. And he was on a medication that would suppress the immune system, and that is currently one of the main drugs that we have to control the psoriasis, right?
mm-hmm.
He comes back one day completely better, only one, like two little spots behind his ears, and I'm like, oh my God, this is amazing, what are you doing, right? And he goes, I stopped eating red meat completely and totally.
Oh my God.
I gave it up, and I have not had a flare up in almost a year, right? And I'm like, this is great. This is amazing. Then you don't need the drugs. You don't need the 3 specialists that you go to, right? You don't need
Yeah.
all of that. You figured it out by yourself. Great job. Keep it up, right? and he lost a lot of weight. He was extremely overweight as well, in addition to his psoriasis, but okay, that's besides the point. He looked great, he felt great, it was wonderful. Guess what? A year later, he comes back again, covered full with plaque, and he goes, I'd rather eat my meat.
Yeah.
Okay, so, but
How
the
did he figure it out? Like, how did he figure it out? And what's
I
up with
don't
this
know.
Chinese who
I don't
knows
I don't know how
drink
he
hot
figured
water
it
and
out, but there's certain things that your body kind of tells you a little bit, and if you listen hard enough, you can actually figure it out. But my point is that not everyone is ready to do
mm-hmm.
the certain things that are required to do of them in order to be healthy. And
Yeah.
sometimes Western medicine gives you an easier way out. So he would rather, go back to getting his injections, go back to seeing 3 different specialists than to deny himself meat.
Okay. Well, all right. Yeah, you have definitely you need to have a discipline, right, to do all this holistic stuff to cure yourself. But how do you?
May I
Yeah,
please
yeah,
add to that case?
yeah, yeah.
Of course, I'm assuming because I have not seen this patient, but I can give a little bit input on how could it be seen from perspective of Chinese medicine. So, generally speaking, of course, with some exclusions, I need to see the patient. I need to ask a lot of questions and listen and feel his pulse and look at the tongue. But generally speaking, psoriasis it's like damp heat and plus something else. But red meat is warm. Some of it is hot because it's different types of meat. So and
What do you mean warm hot?
no, like we're
Elaborate a little
talking
bit.
about energetically temperature of the food. That's what I'm talking about when we say food
Oh,
therapy. We don't look at it as a, again,
wow, that's a whole new level for me.
yes, it's whole new level. That's exactly what I'm saying. So when you have a damp heat in your body already and you add more heat to it, it would cause flare up. And flare up in if it translated to Western terminology, it would be inflammation signs. It would be redness, itchiness, like warm to touch, and swollen. And overweight is again in most cases is damp retention, like translates in Western medicine. It would be water retention or water metabolism disruption somewhere. Like naturally, body was craving to rid of that, so that's why like. We would certainly give recommendations to exclude foods that would increase heat in the body, and we would try to cool him down. And this would be a big part of a protocol because most of herbs that would be prescribed to him would have cooling, drying damp, and like reducing nature, and that would bring things down, would dry, and like a lot of other stuff. So topical agents again with the same features, they would be cooling, they would be like drying, and sometimes yes, people come to you with open arms, ready to accept, ready to heal, and willing to follow, like, and look at you, and with and they trust you, and with this kind of relationship we achieve like fantastic results, especially in these cases where from Western medicine point of view, they're incurable. They are autoimmune diseases or idiopathic diseases. Like is a huge class of these different like autoimmune disorders, and but there are patients who come to you without distrust, from desperacy, just giving a try and don't follow, do once and don't no consistency. Then yes, I'm again not a magician. With every approach, you still have to give it a time and follow through. You see the first result, don't give up, go on, and a lot of these things could be reversed. I cannot say cure because I don't have right to say it like that, but reversed, be taken asymptomatic, so like kind of
Mm-hmm.
put in sedation, there would be no flare ups like that. So yes, I
Mm-hmm.
have I have seen that a lot, and I have in my practice many cases.
You do the
Why?
combination, right? Combination of acupuncture and herbs. You do herbs as well, or
Yes,
you do
absolutely.
acupuncture. You
No,
okay?
absolutely. Herbs is a huge thing. Absolutely, 100%. I do. I use a lot of herbs.
Mm-hmm.
They
So
work very well.
So I love herbs. I love supplements, and I took tons of it. I uh, take less now, and I study every supplement how they interact with each other. But how do like some supplements are so weird, like cordyceps, right? It's a
Mm-hmm.
fungus on top of the worm from
Mm-hmm.
Chinese, right? How did they even
Yes.
learn that fungus up top of the worm can cure disease? Like where all this they do it for thousands of years. How did they learn? Where did they it come from? My guess is aliens, but you probably have another idea.
No, it says this
how
is
did hot water?
really. This is fascinating, it's like sometimes, and believe me, when you study and when you learn how they look, how they have been, like their properties, how they even come up with that. uh,
Exactly, yes.
and and not a thousand, like, excuse me, we live in like 2025, and this medicine is like over 5,000 years, so it was like before even like the written language existed. So how they, first of all, they there was like a scholars, and this one Chinese medicine doctor who would really do a lot of research. Then he would get his like students, and it would be just word by word, generation from generation. There was like, that there were no books yet existed. They were just, walking encyclopedias of the, and this like amount of information, they were just generated really over time slowly. And it's fascinating. In China, like the price of human life was always very, very like small, below zero.
Mm-hmm.
So, and they have not there were no count of human dead bodies, so they always had dissecting a lot of bodies. They always learned and studied it, like even before, way like hundreds of years before Western anatomy has appeared. But they basically, acupuncture is the same. Like operates with the same body, with the same nervous system. It just used different terminology because it was before Western terminology kicked in, but
Yeah, there was
basically
even
same things.
anatomy, right? Not even
Yes,
anatomy at that
totally.
time. So how who
Yes.
were those scholars? That's my
uh,
question.
yeah, but
Mm.
there were like big names of they of it's a dynasties of the doctors that was like they are famous. We have studied, of course. I have not like prepared you the list of their names, but because they're all Chinese and long.
Yeah, that's okay.
Yeah, so but that's how it actually was, just word of mouth. And they would literally teach their students would become doctors, teach their students, and that's how it was, just generation after generation been collected all together, this knowledge. A lot of like research, a lot of hands-on. They are very smart people, and Chinese people are very hard workers, so they really were just put hands their own, did a lot of experiments, just just manually. That's how it was.
What your intake on it, Nadia? Who do you think those scholars were? How did they come up to that?
I don't know.
What we know now.
Right. The way that we know, like, right, like Tatiana is saying, is it probably took a lot of observation, right? They were just like
Mm.
watching how plants
Mm-hmm.
interacted, how animals interacted with each other, how insects interacted with animals, all of that. Because
Mm-hmm.
how do you know how this works? You don't know unless you look. And it's like hours upon hours upon hours of observation,
Mm-hmm.
seeing, oh, this does that, and then if this animal eats this, then the animal gets better, or whatever the case might be.
Mm-hmm.
But I don't know. To me, what was the most fascinating thing about what's used in Chinese medicines? Antlers, the deer antlers.
Yes.
Like the fungus, I can understand, because fungus is more
Yes.
or less, it's like from the like the plant world, right? More or less. But the antlers, I was like, what? And they use it for so many different things, right? Depending on how you use it,
Mm-hmm.
what kind of disease you have, et cetera, et cetera. To me, is amazing. Antlers.
But what like
Yeah.
in Russia as well, and probably in every country, in every like a Western country, if those times like 200, 300, 2,000 years ago, there were a woman in a village, right? Znaharka. right?
Yes,
It's in
yes,
every
yeah.
village there was Znakharka, a woman, a witch. They called her witch, whatever, and she always knew, right? People would go to her, and she would,
Like
do
herbs,
something.
make
Like they,
concoction.
yeah, she would give them something to drink, or she would do some kind of spells, and people would be cured. I know, like from my own family, own family, they told me stories about, this magic happening.
Mm-hmm.
It's like some things were cured that weren't curable at that time, and of course a lot of people died, as Tatiana said, but some things they still help. And they also had this information that that's magical connection to the universe or wherever, how they got that information. And that's also went from woman to woman, right? It was like, and she had to accept it, that knowledge from that
Mm-hmm.
other old woman. Like, how did it?
Mm-hmm.
It's like, it's crazy. Like, they still exist. One of
It's
my,
actually in every nation, in every culture, this
yeah,
phenomena exists. It's just Chinese medicine became so like widely spread, just also taking in consideration the number of people. Chinese population overall is widespread all over the world, and therefore their medicine became way more well known. But every like people talking about narod nation, right? Like we
hmm,
the people, they would have cultural and historical and their own medical like traditions. Yes, totally. Their land would like produce their specific unique herbs, unique substances that they would use, for to heal. So absolutely, it's true, it
yeah.
exists, and it has should not be eliminated, because some of it very are very powerful, absolutely, and could be super like fantastic complement, or even substitute in some cases for Western generalized approach to any disease.
You see, I have
Yeah.
another
So,
question. From my standpoint, right? Here's my question. The supplements that we buy at the pharmacies, at the modern day
Hmm.
pharmacies, the supplements, herbal supplements, are not really well regulated. So it can say
Right.
whatever the name of the herb, like ashwagandha or whatever, it
mm-hmm,
thing, but
mm-hmm.
you really don't 100% know how they prepare it and what the preparation is. And certain companies make it a different way than the other companies, right? Depending on their
Oh,
packaging,
100%. Yeah.
whatever, right?
Yes.
Even like things like melatonin for sleep, right? It's
Mm-hmm.
not all the same. It depends on who made it. It depends on what they put in it. It depends on how much of what they put in it, basically. So my question is, in Chinese medicine, how do you know when you're prescribing, or you're creating the um, prescription for your patient? How do you know where they're getting them from is legit and they're getting what you're prescribing?
First of all, we don't order from Amazon or from any, like we have few marketplaces specifically for our acupuncturists as a profession. You can only order from them if you are fully licensed and like you have an account through them, and patient cannot just go on the website and order. No, he can only use my prescription, and even with and uh, all of the suppliers who present at that marketplace. Like for example, I just don't want to advertise anything, but there are a few very well known in state of Florida which every acupuncturist use. Just and
Oh,
recently,
advertise. If it's good ones, why not? Like, we want to
not
know,
like
like, what.
like personally, I love acumarket.com. It's very like I like it. Although now every platform experiences some difficulties with the supply just because of this like trade wars. So many herbs go out of stock so fast, so I have to choose what is available and form what is available, because I have my personal priorities, because I have found through practice that some specific brands much more effective. I have to use less dosage to get good effect, and they all are what we call uh, this like great practice manufacturing, so they all are like meet the certain requirements. They all
Tested.
been Yes, totally. Yes, third party tested, and they're manufacturing like a good manufacturing practice, GMP.
Mm-hmm.
They all qualified to be able to sell it in United States. So that's how it is. It is all regulated. So it is not as a supplement. Supplement falls under other category. Yes, the supplements, certainly with supplements only, like again, I because I'm a bigger user and a big like my scope of practice allows me also to to give recommendations all about nutritional supplements, and moreover like homeopathy and homeopathic injections and all of that class of drugs, because they still fall under that.
It doesn't mean that they have to buy it. They have to do their own research always. You probably take supplements and herbs like every day, or maybe not.
Yeah,
And which ones you take and which ones you think like everyone should take. And that's the same questions would go to Nadia, like if you take anything and like what you think every person should take every day.
I don't take something like because I think I should take. There are just
Mm-hmm.
some concerns that I have, and especially with herbs are very specific. And as soon as it's resolved, I either take a pause, because we have what kind, like same as in Western terminology, right? We have different like genetic types, body constitution. So we tend to develop some sorts of pathologies depending on that. So, like for example, if you have spleen Chi deficiency constitution, so you tonify the spleen, your spleen functions well, but as soon as you get overwhelmed by stress, overwork, over like had some rough, I don't know, negotiations, whatever it is, and it like your spleen is again like deficient, so you go back to that to just tonify it again. So there are certain formulas and herbs that would be suitable for this specific like presentation, like overall like personally for me, like I become Chi deficient very easily, just because I used to give away a lot of, like I'm a giver of energy, so then I'm like, okay, I have nothing left to me, so I always tonify my
What
Chi.
you're all deficient? What deficient? I thought
Chi,
you said
chi,
D.
chi. So in Chinese Western term, like in Chinese terms, like chi is energy. So, and it could be lung chi, it could be spleen chi, it could be like liver chi. So in my case, it's spleen chi. So there is formulas that are specifically for tonification the spleen. So that's like Sejun Setang, like for gentleman decoction is my like go-to. I take it like I cannot say always. Again, as soon as I feel okay, my pulse is fine, my tongue is fine, I'm full of energy, I don't need it. So
What
that's
is
why
it? What is included in that? Is it a formula? It doesn't say it's a
it's a
few herbs.
formula. Yes,
What
yes, it
kind of
is
herbs go in this formula?
it is a formula. It has four herbs. Give me 1 second. I cannot, I mean, it's super basic. I will just tell it to you right
I
away
see the
because
tail. I see the tail there.
it's
Here,
my
here.
because my kid came just there. So it has Renshen, Fuling, Baiju, Jigansao, Shengjiang, Idazao. So
Are they
and
have English alternatives for this for those herbs? Words,
uh,
I mean, like my
I
that
can
people
read.
would recognize.
I can read to you. So Asian ginseng root, Boreas sclerotium, Baiju attractylodis, baked Chinese licorice root, fresh
Uh-huh.
ginger, and jujube fruit.
Okay, that's a little bit more close to like
Yeah,
some.
yeah, but like to be honest, I never memorize and learn like English or Latin names for it. It's just impossible. I only learned Chinese because all the exams are in Chinese, and I had to pass exams, so I only know my Chinese names. Sometimes I very like I still would discover. Oh, this herb is this. Oh, funny, because I could even know it from my Russian background, but I don't link one piece to another. So it builds over time, because it's like I have to deal with three languages,
Yeah,
So
but it's like 99.9% of people don't know that Chinese like nor variations of these herbs. We know only
yeah,
English or we live here or Russian.
Latin names
Yeah, like
also big,
ginger,
big
that's
of them.
something I know. But whatever you said
Yes,
before that, but I never recognized that. So
yeah,
that's herbs and roots and probably adapted genes, right? That include and that
yes, yes,
additionally.
yes.
Yeah. For example, if you got cold, like what do you take?
Oh, if I again, a cold is we don't look as a very uh, um, that's why I find a lot of correlations between Chinese medicine and chess, because this is like, or like cold is like an umbrella, and there's like so many variants. What it is like, what is this called? So if we say is like deficient cold, then I would take a like Gujitang, because Gujitang is the formula for what we call exterior invasion deficient type. What means deficient type? If your pulse is floating and like you would have no sweat, and you would like shivering. Guji tang, basically guji is cinnamon. So it's
Mm-hmm.
warm. It's warm and it's
Okay, you
some
take cinnamon if you get cold. That
yes,
okay. That okay.
basically
Okay,
yes, in this
perfect.
formula.
That's
But
why Chinese
yes,
people told us to drink hot water because
yes,
before you
yes.
explain anything, it's
But
just so much easier to say, boil some water and drink it.
but you know what is funny? If you now go to any Western doctor, like so many complaints you could read online, because all of they saying to their patient is to drink enough of water. You could come with migraine, you could come with diarrhea. They have one general recommendation: drink a lot of water. They would not say even cold. They were hot. They would tell like cold, like any water, just drink water. This is solution now for all Western doctors. It's a lot
Okay,
of
that
jokes about this. Like, do you agree with me, or uh,
Nadia.
Nadia?
It's a
Yeah,
hard about supplements, right? People ask
yeah,
Uh-huh.
a lot about supplements. From my standpoint, if you live here in the United States and you eat a balanced diet, which we're blessed to have access to fruits and vegetables year round. Remember how it was back at home, Natasha? You probably, Tatiana probably also remembers.
oh
We
yeah,
only had access to fresh fruits and vegetables in the summertime and the springtime, majority of the time.
Yeah.
yes,
And
oh
then
yeah.
fall and winter, we had zakrutki, we had our marinated vegetables. We didn't really have
I had potatoes.
right? But we didn't really have fresh vegetables and fresh fruit in abundance, right? Where we could get a lot of
Yeah.
vitamins in. So, but here, living in the United year round, you can get all kinds of fruits and vegetables delivered to your house, even if you don't want to go out anywhere. So essentially, my approach, as again from the Western side, is that if you eat a well balanced diet, you don't necessarily have to, and you feel well, you don't really have to have any supplements. If you're really doing what you're supposed to.
I knew that. I knew you would
I
say
always
that.
right. I always say that. I'm like, why would you take something that
I
you
knew
don't?
you would say that.
Why would you say if they insist on me like recommending something? I'm like, take a multivitamin.
Yeah.
So for women of childbearing age, I tell them take a prenatal vitamin. Not because you're trying to become pregnant, but because if you're still menstruating and you're still having menses, you could benefit from additional nutrients, right? Because you're losing blood, obviously every month. But if you're not a menstruating female, if you're a male, there's one a day for men. There's one a day, 50 plus for women, which has more calcium, more vitamin D for osteoporosis, things like that. But it's
Mm-hmm.
honestly, I very rarely recommend supplements unless you have a complaint, right? So if you're
Mm-hmm.
not complaining of anything, if you feel fine and you're eating the right things that you're supposed to be eating, I'm like, why would you take something? Don't take anything.
Uh-huh. All right. Okay. So here we
But
go. Well, very
I
different
have
opinion
I
about
have an objection to that. I have certainly an objection to that, because
Okay, go ahead.
I myself use a lot of supplements, and I've been like that since my early times, and I have done so much research, and like I cannot again, I cannot recommend it to everyone, especially in
Just say it for yourself. Just what you did.
yes, exactly. I can tell.
Yes.
Like for me, my must take for that I do for years is like liposomal glutathione with vitamin C is my go-to. For many years, I start taking it like at 19.
Okay.
when
Okay. We're getting somewhere.
yeah,
Okay. I like that.
when
Okay. I'm
when
writing it
when no
down.
when no one has even known anything, because now it become very widely spread, especially with internet and all of that. So much research now become like you go on PubMed, you can read so much information how effective it's like one of the most powerful antioxidants. And if you care about your liver, if you care about your overall well-being, and you want to age gracefully, I think they should be in your
Say it
like
again. Say the name
regime.
again. Say
No,
the name again.
liposomal glutathione and vitamin C. They just have to be taken together because they would enhance their absorption.
What people would most likely to see the name of it? They probably not going to be probably the whole name. It's probably it will be L something, right? The more
Uh,
common that name.
like the supplement itself is called glutathione.
Oh,
The
L-glutathione. Okay,
yes,
sure.
yes,
Yeah.
yes.
Uh-huh.
The form of which is the most bioavailable is liposomal. It's just because it is the best form to be absorbed, and to
Mm-hmm.
be even better absorbed, they better be consumed together with vitamin C.
Mm-hmm. The
That's
synergy.
just yes, yes,
Mm-hmm.
and
Mm-hmm.
many other things I do. It's just with this, I think no, like for me. Me, my son, everyone around me who is in my inner circle, once they start taking it, they it's very hard to give out because it's really it just helps to detoxify everything so much more effective,
Mm-hmm.
and just
Mm-hmm.
overall. And we get intoxicated so easily, like depending on our diet, depending on our how we process food, how we cook food, how like very easy. So many people with sensitivities and stuff. So you could even have super healthy diet to still be like living in a big megapolis inhaling, because the air is very polluted, water is polluted, so it's like you build up toxins anyway. And it's like both your liver
Mm-hmm.
and kidney is the only organs in your body who would do that processes of detoxification, so why not help them somehow? But it is my view,
Absolutely.
again, it is my view, because totally Nadia's view on that is totally relevant as well. So I think in this ways people have to choose for themselves, make their own judgment decision. And I think both approaches have totally right to exist.
If somebody comes to me and says, I want to take glutathione and vitamin C, I'm going to tell them, okay, sure. Right? Like, I'm not
Yeah.
going to tell them, don't take it. You're going to
That's
die
two
from it
different,
or
two
something.
different,
Like,
two
no.
different sides. But you would
Right?
not recommend?
So I would not necessarily tell everyone, all of my patients take it, right? But if they come to me and they say, I want to take this, unless they have like some kind of a contraindication, which majority of the case is not the case, right?
Mm-hmm.
Take it. If it makes you feel better, sure, why not? I totally can respect the fact that, if it makes you feel better, sure, do it. Right?
Mm-hmm.
Why would I, right? But then
Yes.
essentially I would not say to every patient, you need to take it. That's what
No, totally, totally. With this part, I agree with you absolutely. That's where I started also with. Like, I totally always respond to requests, and if a person is looking to make some adjustments, I'm always like be like suggesting this or another way. But I would never really like insist on something, or like with herbs, I could be telling that if we because many cases, deficient cases, if we really want to get a person to build it up, only herbs can do that. So for me to be able to help her and maintain the result longer, because acupuncture works definitely, but for how long it works, I cannot tell you. Because some people, like for me, my ideal goal, I see you very, very rarely, but knowing that you are great, But if the effect lasts only 2-3 days, some cases it's excellent, with severe neuropathy, if they have 2-3 days without pain, it's excellent, but then the pain would kick back, and I'm not a magician again, because I just operate with your nervous system, that's it, and their herbs must kick in, otherwise I cannot prolong the effectiveness of the therapy. Then I have to see you every other day or every 2 days, or like often. And that's actually how it is treated in China, because in China it is like, it is totally a part of lifestyle. Every Western hospital has traditional Chinese medicine department in it, and they goes very well hand in hand. It's my dream that it would come. And actually, Canada is also big on that as well, and it's like, our neighbor. So I hope in my lifetime I would experience that it would become also very, very widely used here as well.
I wanted to go, let's switch from that very smooth subject and go to Brian Johnson. And we already talked about Brian Johnson's on one of our podcasts when we talked about longevity and rejuvenation and all that stuff. It's the guy who was tested the most in the entire world. He's tested on for anything every single day. So he knows his body from his nails, toenails to the top of his hair. And so he used to take about 100 supplements, 100 pills every single day. Now, after all these tests, he came
Now
down
he's
to
selling
about
his own product. That's what he does.
yes, yeah, but before he started doing his product, he took about 100 every day. Now he takes about 27, 40, so he went down quite a bit, right? And there's the supplements he takes all the time. I wrote them down, and you tell me if you agree that we have to take them every day like he does, or recommendation, or there's something maybe you shouldn't. Like for example, turmeric, and some of them I probably will not pronounce correctly. Quercetin, it's a new antioxidant. It's for a few years old.
I also take it every day.
Natasha, wait. Go one by one. So say turmeric.
Okay,
right,
okay, turmeric. Yes.
So turmeric, I normally advise my patients who have osteoarthritis, who have like recurrent inflammatory issues, right, to decrease the inflammation. So those patients, I normally recommend it to. In general, if you think about it, it can help with like everyday aches and pains, I guess, that are normal for like body wear and tear, right? But again, to take it every single day ever since he was what, 20 years old or whatever. When did he start doing this?
I don't know. He's 40 something now. He's we talked about his erections. That he can't. But I know that more about his erections more than about his supplements and where he started taking them. But yeah,
like for turmeric, I would say, okay, if you have inflammatory diseases, if you
it's
have
anti-inflammatory. Yeah.
you have, okay,
Yes, it's something.
but to take it for every single day for however long he's taking it, I don't know.
Yeah. And what about quercetin and the big one? That's a huge one right now. Everyone is talking about it. That it's actually rejuvenate. Okay, I'm not a doctor, so I'm saying whatever I can say it. Mitochondria, and
Yes.
and that's NAD, right? And
Yes.
so the NAD is like crazy right now. So what do you think about
Yes.
NAD?
I do take it. I do take
You
both,
you
but
take
I
it?
don't.
Okay.
Yeah, and
Every day?
yes, and I like about turmeric. I have it, but I don't take it. I totally look at turmeric like Nadia said, because only if I start having like feeling aches and pains, then I take it. But then I don't. But probably I first of all I listen to my body very well. When I have symptoms, I take. Symptoms gone, I don't take. So I look at it more as a symptomatic versus constantly taking it, because what it does, it decreases the inflammation levels of your body. And if you don't have inflammation markers, no, I mean like symptoms, okay, why then you would keep taking it? It doesn't make sense. Like, why to waste your like supplement? So for me, turmeric is more symptomatic. So versus quercetin, yes, I take it as an antioxidant. I take it every day, especially for people like I'm 44 and I want to age gracefully. I don't give it to my son who is 14 years old. Although, for example, if you are allergic, if you are a very, very sensitive person, quercetin, you can't look at it as a Zyrtec. It has totally different mechanism, but it in a way desensitizes you to a lot of allergic substances, so you not overreact to many things. So like quercetin is also prescribed for that purpose as well. So if you have a lot of sensitivities, quercetin taken daily would reduce your response to any sorts of allergens. So
What about
so
NAD?
an idea, I take it. I have read a lot of research and I have listened to a lot of medical doctors and holistic doctors podcasts, and I made my own judgment that I'm taking it. So it's very new. So I don't do any IV because it is like it is like stated that better results come out of being administered like
Yeah, a lot of people
intravenously.
inject it. Yeah.
Yeah, not inject, intravenous, but I can afford the oral pill, so I take. I'm very obsessed with this longevity like idea, and I try to, like, if I can do that, and I like what I read on PubMed and all this like research supported, that I also take it.
I know that some people inject it like in their hand, arm, and like the boom, the
Yeah.
NAD. But I heard that also if you take too much of antioxidants, it's actually will be an opposite effect in your body because it will protect the something, the cells that shouldn't be protected, and opposite of um,
And for that
killing
you
those
take,
cells,
and
they
for
will
and
be
for that
thriving.
for that you take spermidine. It's another substance that I take every day, and
Which one is that?
spermidine, and this supplement aids to autophagy in your body. What it is, exactly what you're
Oh.
doing, so that the cells that has to be like killed and like processed and cleared out of your system, like this supplement aids to that. So that's why I take
Oh.
spermidine for something for like so. But again,
So
it's
it's
my
like
approach.
shortcut. It's like the
Yes,
spermidine. It's like shortcut for
yes.
fasting. So you don't have to fast. Instead, you take that supplement. Is
No,
that how it is? No.
no, no, I would not say.
Uh-huh.
I'm a strong supporter of fasting or intermittent fasting. I think nothing could be better for you. Of course, being prepared, not being like with entered with like understanding and awareness, and exit it as well also properly. So with the preparation, or just do intermittent fasting. Like skip one day, and this would really induce that. So
Mm-hmm.
like no,
I
like
thought you don't have to
believe.
fast. You just take
No,
this supplement and
no, fasting is
okay.
good. Fasting is good. So there's no shortcut to fasting, but it would help certainly. It's also absolutely scientifically proven. Been all this blind, how say double. Nadia, correct me please with the right terminology.
Double blind,
Double blinded
double blind study. That's what you're looking for.
study.
Uh-huh.
Yes. So that this substance, the supplement really helps like with the autophagy, and it's very good for longevity and everything. Like so.
Like it's the same token. If we're talking about longevity, there are also studies that metformin elongates your telomere, so it therefore prolongs your life.
Yes,
Right.
yes, I agree with you with that, but I don't take it like with that. I'm being a little bit. I have read that. I totally like. I'm not opposed to that. I just make my own decision that I'm okay without it.
Tell me this word. I always forget. Audafi. What do you get after the fasting?
Autophagy.
Autophagy. That's what you get after fasting, right? As
Yes,
the body cleans those dead cells and everything, and also with
yes,
that supplement. Perfect. I love it.
yes.
I love it. That's one more. Okay, let's go to the. Well, by the way, Nadia, what do you think about NAD? Because NAD is on top of people talking, so it probably will be interesting from your perspective as
Like,
well.
the thing is that listen, the same thing with glutathione. Glutathione, people at some point, I think maybe like about 5 years ago, everybody was doing IV glutathione. It was the thing to do, right? Okay, is it like if it was really, really, really that good, why are we not all on it, right? Why is it not in our drinking water? That type of situation. That's what I'm saying. Is that there's no cookie cutter thing that every single person should be doing because we're all different, we're not the same.
Well, true, but unless it's for example vitamin D, right? For example, we don't get enough of that, or vitamin C when we get sick, for example, like
Well,
some like basic. Those are basics.
well, okay, vitamin C depends on what you read lately. It's been said that it doesn't really work for a common cold and flu anyway. So,
Mm.
so okay, like if you're taking vitamin C to absorb more iron because you're iron deficient, that's one thing, right? If you're just taking it when you have a common cold and flu, maybe not so much, but whatever. Say I still take it just for the placebo effect because it makes me feel better, right? So it doesn't mean that it really everyone should be doing it. I just take it because it makes me feel better.
Well, some things are just work. Like work, for example, adaptogens for me, like reishi is the way to go if I have just a slight cold coming up, or if it's like flu season, I would like take extra suggested in daily norm of reishi, and I think it helps. Or any other not any other adaptogen, but there are a
Mm-hmm.
bunch of adaptogens that you can take, and it actually um, makes your immune system stronger. But let's get back to Brian Johnson, right? What I'm probably not gonna say, we're not gonna discuss each of the supplements he takes, but some of them. It's L-theanine, and you will stop me which one. I will tell you a bunch of supplements, and you will stop me and tell me which one you want to talk about, right? Maybe one of those, the most important than others, like L-theanine, omega 3s, so it's a bunch of omega 3s, not just one. Melatonin he takes every day.
Let's stop at omega 3s.
Okay.
So Western medicine has long, for the past at least 7, maybe 10 years, has distinguished that there's this one preparation of omega 3s that is superior to the other one. So the omega
Uh-huh.
3s that we have on our shelves in regular, oh my God, I forgot, pharmacies, right? Omega 3 that we see on the regular shelves is not necessarily your friend when it comes to your LDL, your bad cholesterol. It will
Mm-hmm.
help you greatly with your triglycerides. It will decrease your triglycerides if you have them elevated, but it will also increase on the worst side of it, increase your bad cholesterol. Whereas,
Mm-hmm.
whereas if you choose a preparation that is cleaned up, and it does exist, and it's prescription medication, which insurances doesn't necessarily want to cover, but that's a whole different thing. Purified version of omega 3s, okay, which is molecularly different. If you're looking at the molecule, there's a very slight difference, but there is a difference between the regular
Mm-hmm.
omega 3 and purified omega 3. And the purified omega 3 has been scientifically proven to increase outcomes when it comes to cardiovascular diseases and cardiovascular deaths. And it does not increase
Oh,
your
it's increased the death?
no, it improves your risks of dying. So it decreases it decreases your possibility of dying, basically.
Okay, so it's good. Okay.
It has a really good effect on your cardiovascular system, right? But when you say
Mm-hmm.
omega 3, right, what do people hear? They just hear omega 3. They don't hear the differences that there are different ones. There are ones that are not really great for you, and then there are ones that are purified, and that those should be taken, and those should have
Mm-hmm.
been studied, and those actually have been proven to have a really good track record, and improve your life and prolong your life in many cases because they can save your life. But essentially, when people say omega-3, they're like, oh yeah, I'm going to go and buy omega-3 over the counter. They go and buy it, and they probably can harm themselves more than they can improve their health. So at
Mm-hmm.
that point, this is something that I really feel strongly about when people come to me with like omega-3 questions. Depends. Not everyone can take that over the counter stuff.
Mm-hmm. Okay. What do you think, Tanya?
I agree 100% with that. And the omega-3, I don't take myself. And it's very controversial. So I take only, like, to be honest, you mentioned L-theanine. I take it, I have it, I do it every day, but I cannot tell you because I have so much information in my head. And I just, to be honest, I just know it's good because I researched it, but I cannot recall why, to my
Yeah.
shame. But omega-3, I don't take. I absolutely agree with what Nadia said. And like, it's very controversial. So many researchers supporting, so many researchers would not support. So it's very controversial to me. I would
Mm-hmm.
not take it every day, and I would not take it long term every day. Especially, it could be very damaging. Like I cannot be sure about that for sure.
Uh-huh.
And the same melatonin. I like for me. I first of all, personally, for me, it never worked. It only makes, and I played with different dosages, with small ones, with big ones, with medium. So no, it only would give me crazy, ridiculous dreams if I go high, and not no effect at all in a low dosages. So I just really, for me, nothing works better if you had a very long, busy day. Then you had a hot tub with salt and with essential oils, and then you sleep like a baby. And if you don't sleep like a baby, then you really need to work hard during the day. No, you
Yeah.
just need to spend the energy. That's my approach to that.
But also omega-3, it thins blood, right? And could it be taken? And blood thinners in forms of supplements. They can be good, they can be bad. If you take it too much, it can be too thin of a blood. Is not If blood is not good, right? It could give you, from what I've read, aneurysm and all other stuff. But could it be taken instead of like medication for blood thinning?
No,
Omega-3? No? Why not?
No, no.
Why not?
because
uh,
it's not a blood thinner. It doesn't thin out your blood.
It does. It does thin your
Not.
blood.
No, it does not.
Like they recommend that, for example, if you have surgery, they
Mhm.
tell you not to take fish or omega-3 because it thins your blood. That's exactly what they tell you.
It doesn't. It
It
doesn't.
makes you more bleedy.
No, it doesn't thin your blood to the point where it has been approved for to use for like known blood clots or no
Okay.
agents
yes.
Mm-hmm.
or anything like that.
They do that just to exclude any possibility for you later to be suing them. They must tell you to do that, just because not later would not be used against them that they have not warned you. But it is it like, for example. And in Chinese medicine, if what we call blood stagnation, if I would see in myself some signs of blood stagnation and I really need uh, to address it, because if it like very slightly and does not bother me, I wouldn't even bother. But if it does, then we just have a blood quickening like category of herbs that work well. And again, it is short term, just to resolve the symptoms and go on. Like blood thinners, you would like, unless it is Western medicine approach. If you have a like blood clotting problems, then yes, you would be put on a baby aspirin dose long term use, and it has its side effects. But that is a weakness of Western approach, because they solve one problem but cause another. And unfortunately, in Chinese way, we do it different. So it's like, if you have blood stagnation, we resolve it and we go on. We don't prescribe it long term. So
Mm-hmm. So
so
I'm nowhere where you are in your knowledge of herbs and everything, and I'm obviously not neither from medical side. But for some things, for the new studies and everything, like we're probably somewhere at the same level just because we look and read the same studies, and some of them just
Mm-hmm.
anecdotal, then some of them just not even like proved and double blinded or whatever studies.
Mm-hmm.
And there's, for example, even for multivitamins, like few years ago, right? You could read it everywhere. Okay, multivitamins are actually not helping your health; they're actually harming your health, right? So you're not should take multivitamins every day because they're not helping. And in a recent study which came probably a few months ago, they said that that study was not the correct study. It was the wrong study, and no one should pay attention to that one because it wasn't blind sided or whatever, not blindsided, double blinded study.
Mm-hmm. Mm-hmm.
It was with a small group, and it's actually you're supposed to take vitamin that because they do improve your everyday life, and they give you what minerals and vitamins you don't get from your nutritions. So all this, like, there's so much information that comes up recently. Something was bad, like coffee was bad, now it's good. Eggs were bad, now it's good. It's all these, studies that you don't necessarily get in college, but when you get from like googling it, right? We're all the
Right.
masters
But then for
of
example,
Google.
like
PubMed, I
Or
recommend.
PubMed, but still,
Yes.
no,
still,
but
yeah.
even PubMed, what we are taught to do throughout, like starting from bachelor's and going on and on through master's and doctorate, they teach us to evaluate the study. So when we read the studies, we have to understand beforehand, is it double blinded? Is it not double blinded? How many participants?
Mm-hmm.
What is the statistical error, et cetera, et cetera, et cetera. All of that, when a person who's into medicine science, like, we know what studies are worth paying attention to and which are not. That's
Yeah.
right.
Oh,
Versus whatever is being thrown into social media, right? Oh, a study was done and this was found, but it's a crap study because
Yes.
they don't tell you.
yes. But talking about crop studies, girls, what do you think about hormone replacement therapy? Because it was known for about 30 years, right? That it was studied and it was bad for you because it can induce like cancer, breast cancer, or other stuff. So you shouldn't take it. If you should take it, you should take two hormones instead of one. And it's just that cancer and this cancer. And boom, a recent study like a month ago, they said, you know what, whatever was they're studying at that time, it was a very small group of old people in what study only one type of estrogen, which is synthetic. And if you do a bioidentical, it's completely different story. And now they come up with this new information that actually it's beneficial for you in so many ways, and it doesn't affect in any rate your breast cancer. Uh,
So that no, but that's not true. If you already have breast cancer, it can make it grow faster.
if it's hormone
It does not make you have breast cancer. It doesn't
that's what they were
make it
talking
up.
about. That's what they were talking about. That it's actually can, like,
No,
what
Increase the
that's the problem. If
chances.
increase the chances of breast cancer. Yes, thank
you
you.
don't know that you
Mm-hmm.
have breast cancer, and if the cancer is so small that it's undetectable by imaging, right, and you don't know you have it, and then you start taking it, and then you have breast cancer, then what is the normal logical in your head? The logical is, I didn't have it, and then I took it, and now I have it, right?
Okay, here's the idea.
But
But what
that
was the
might not be
different
the
idea?
case. But that might not be the case. You might have already had
Yes.
it. It was too small and anyway. But I might change my point of view on this when I'm in menopause. I swear I may, because just looking at my patients, right, how they don't feel good going through this transition. But so far, right now, my stand is that unless your symptoms are absolutely horrific, that they're ruining your life, you
Mm-hmm.
don't need it. If your
Mm-hmm.
symptoms are so bad that they're literally not letting you live, this is the person who needs it. And those patients are not 100% of cases, right?
But it's not only symptoms. It's a bone density. It's so much comes from
It's
using menopause.
a natural process. It's a natural process.
Screw the natural process. No
We're
one wants
also
natural
going to go
process in
through
21st
it.
century.
The way and no, but like the thing is that we're all getting old anyway. Even your Brian Johnson dude, he's still gonna get old, okay, and still he's still
We're
gonna
gonna
die.
get eventually, but maybe not as fast as us. What do you think about hormone replacement therapy, Tatiana?
I have my strong opinion on that. And it somehow also correlates with Nadia's point of view. First of all, I look at aging again, like from Chinese medicine perspective. More and more deficiencies start showing, and what we do, we supplement them, we tonify them with herbs, with acupuncture, with changing of the lifestyle, with adding or taking something away from your diet. So it's a complex of reasons, and like there are few fields, actually a lot of fields to be honest, but some very certain fields in Western medicine that have not been yet discovered to the degree that I would buy that, and the hormones is one of them. It's like brain, hormones, and the nervous system. These three fields is like so, and the immune system, like it still has huge potential for discovery, and I would it would be my last call to interfere with it, to using Western drugs, because so much deficiencies could be supplemented more safely, but at the same time effective way. Because have you seen how Chinese, or like women, or like gracefully age, who especially who take care of themselves, they, like they doing this martial arts still in their 90s, and they're very sharp, and their cognition is amazing. Yes, your boobs will sag, but like if I know I have some chances to develop cancer, and I have seen people like that, and even in my like friends of friends, so very like in a close even circle. So it is controversial. So
It is.
unless it's very very really like disturbing symptoms that really like you cannot function properly, like then I would not myself do that. I would
Mm.
I would try to utilize any other approach, and only if nothing works and I'm miserable to the degree that like I don't care. Like, so it pros and cons for me. So like it should be so bad that I would try to. It's like to me. I try to stay away of some things that I believe have not yet discovered fully. I don't trust that. I'm sorry.
So well, I don't know. I don't know about this gracefully aging thing. I don't think, Tatiana, you would love to age gracefully. I think we would use anything possible
But
to
that's why.
actually
But
age slow. Like you said, you're so into rejuvenation and all that stuff. So I don't think you're about aging
But
gracefully.
that's
I'm
why, but
not.
that's
I'm
why I'm
not.
taking, but that's why I'm taking so much herbs, so many
Exactly, not aging
supplements.
gracefully. It's not. It's
But
helping
that's to me,
yourself to not age.
but that to me is aging gracefully, because it's still every year, out of sudden, I have +1 in my passport. Like, next year I will turn 45. Nobody can prevent that from happening, unfortunately. So that's what I call.
What
It's
do
no matter what I do, I would still be aging gracefully.
we do? I think doing Botox and all the cosmetic procedure, it's not about aging graceful. Aging graceful would get your wrinkles, get you great hair, and be happy about it. If we do all cosmetic procedure, we're not about aging gracefully, girls. We're not about that. We just want to stay as young as long as possible. That's what I think. And if we do Botox and we do other cosmetic procedure for our faces to look young from outside, so why don't we take supplements, right, to do
Yes.
the same for our bodies and stay as young as we'll make our organs, what we don't see, also like feed our faces, and like don't our faces don't go like, or our bodies don't go ahead of our faces, right, in aging.
Yes.
And so there is if we can do it with supplements and herbal medicines, why not to do it? Just not harm, right? Not harm, but
Yes.
do better.
Yes.
And talking about this, and I saw you getting some stuff out of your bag, and I want to see it. But before that, I
But
want
that's
to,
why I was telling you, aging gracefully. And look, this is
yeah,
just
here we go.
my just everyday herbs that I just have in my bag. I take them everywhere
Oh
I
my
go,
God!
because
Oh my God! This is
that's
vitamin
yeah.
D3 I see right now from
No,
Trader Joe's.
no, it's
No?
not vitamin D. It's
Oh, it looks like
this is
vitamin D.
this no, this is
The white one.
exactly. The white one is Lingji. It's what you call
Oh,
reishi. Reishi.
oh,
In
I want to
Chinese, we
talk
call
to
it
you, and I want all
Lingji.
of that.
It's
Uh-huh.
Lingji. And like, go jitsi to sitsi, and because my vision started a little bit declining, and Duzhong Suduan, just because I work so much and I start
Which one is
feeling
that? Dijon, what is
Duzhong,
that?
Duzhong
What's that?
is the herb, that the tonifies
English version?
kidney. Uh,
English
I,
version of that?
Euphomia bark. I have no clue. I only know Chinese. Euphomia bark. It's a
Okay,
bark
some
of
kind of bark. Okay.
Euphomia. Yes,
Okay.
and Sudan. Sudan, it's what we call power couple. These two herbs must be, no, not must be, but should be better taken together because they mutually reinforce each other. If you like Dujong and Sudan, Sudan is Dipsacus root, Dipsaci radix, if in Latin. I have no idea. I only know Sudan. So they both are, symptoms would be weakness of the knees, lower back, like weakness. They just very good tonics for the kidneys. It's just when you work, and I've been working so hard lately. So just to be able to still function and provide a good result and feel in energy by the end of the day. I just support myself very much because I don't know how people can like work hours and not support themselves, and they really like losing it.
Yeah.
And yeah, and to me age gracefully is exactly is it just time comes by and you still feel good energy, you still feel young, you
Yeah,
feel
but
young.
it's
You could,
difficult if you don't do anything. It's difficult.
yeah, no, to me it's
It's
impossible. It
impossible.
would be impossible, exactly. That's why I'm so obsessed with what I do, because one of my most favorite patients in the clinic, she's like 94 or 95 years old, like way more than 90. And I inherited her from the doctor I like started work together with. Doctor retired, and I inherited her patients. And this lady started going to my doctor like 25 years ago when I was not even in this country.
Hmm.
So and you would like, I would think she's like in her early 70s, so she looks like, you would never think she's like 90 something years old. And she doesn't give you the vibe of this age, and her skin and the energy and how she speaks, it's unbelievable. Because she has incorporated in her lifestyle going to see acupuncturist and taking these herbs and supplements from very long ago, when it was
Hmm.
totally not a common approach. And
Yeah,
it's like she's my living proof that this works, and you could
that
really,
works.
yes, I'm so
Hmm.
happy always, like. And like, she's one of my favorite patients because she's just unbelievable, and she reacts to everything so well, and body is very responsive, and like we're doing so much magical stuff with her, magical in like not in a esoterical way, but I mean gives so good results. So she's a living proof that if you really take care of yourself holistically, we different. Like, I won't be aging like her. That's what, to me, gracefully. It's like,
Yeah,
yes, you're old, but you are old lady, in a good health, in a good cognitive mind, everything, like, amazing. So it's
yeah. But you
possible.
don't let your age just take you. You do something to not exactly defeat it because you can't, but at least be like comfortable in your body, and I don't know, do exercise, do push-ups at like 90, maybe not push-ups. But Nadia, what do you think? What about you? What your definition of like aging gracefully? And also I have another question. Um, you're Korean, so and there's a lot of things in Korea or in Korean among Korean people that uh, they do for health as well. And I mean, like in terms of nutrition, for example, kimchi, right? That everyone's recommended eating kimchi for your gut flora and stuff like that. For example, maybe there's something else.
again, this comes down to a cultural thing because in Asia, in all of Asia, as you age, you want to age because you get more respect and you get a higher hierarchy as far as like in the society, like people look up to you. It's a Western culture that brought to us this ageism and even like hatred of getting older, essentially.
Mm-hmm.
It was not,
Mm-hmm.
it's not an Asian thing at all. And Asia, in Asia, as you age, you get more and more respect and you look forward to aging because it's a part of your life where everybody looks up to you basically, and you have the right to give advice to everyone, to, you know, people, again, people listen to you and adhere to your advice, etc., etc. So versus now, yes, now everybody wants to look like they're 20 in their 60s, right? Look at J
Right.
Lo. J Lo looks amazing. I don't know what she does, but she looks amazing, right?
Yeah.
So to me, as far as, definitely yes, I don't want to see my age become, my face become wrinkled and I have gray hair that I specifically, right, I dye it so that you don't see it. Um, so there's definitely things that I don't like about the changes that are happening in my body.
Mm-hmm.
It's where you draw the line. It's where you draw the line, essentially, and it's, again, it's a personal thing. Like as that Brian, whatever, what's his name? What's that name?
Johnson. Mm-hmm.
Johnson, right? So his line is like all the way up here, right? Versus
Yeah.
even if I had all this money and all this time like he has, I don't know if I would be investing so much into what he does. You understand? Because
Yeah.
only just because it's my personal thing. It's not only because I don't have the resources that he has, but also even if I did have the resources, I don't want to spend my life being a lab rat and
But he doesn't want to
measuring
die.
and
He's in
measuring
another level.
and measuring and measuring my every little thing and everything. I don't want to live like that. It's not life for me, right?
Yeah.
So it depends on where you draw the line, and that's the same thing with like hormones. The same thing. And again, I'm telling you, when I get there, when I get to my perimenopause, my menopause age, I will probably change my mind if I have horrible symptoms, right? I will tell them,
Mm-hmm.
give me whatever, I don't care, just make me feel better, right? If I have bad symptoms.
Mm-hmm.
But if I don't have bad symptoms, I don't feel it's necessary for me to be, it's the same. Okay, easy example. When you have a cold, what do? Right? A lot of the
Take
people
reishi.
a lot of the people, well, you will take reishi, right? Some people will go to pharmacy and they will buy all the ibuprofens, all the everything that they can find over the counter, and they will take multiple of the things to make them feel better, right? My thing with the cold, I would write it out. Majority of the time, unless it's like horrific, I will write it out. Why? Because I firmly believe that my body can take it. It's fine. You know, my body has enough,
Not me.
you
Not
know,
me.
enough
What do you mean, what do you mean write it out? I don't
Write
quite
it, write
understand.
it out, meaning that I don't like to take anything for my cold symptoms. I'll just let it be. Like if I have a fever, if I have a fever
Okay.
for like, okay, obviously if it's lasting horribly long, if it's super high, yes, I will take something. But if it's not
Mm-hmm.
high, you know, and it's not going on for hours and hours and hours, I'll just let it be. Because why? I
Yeah.
really truly believe that's my body trying to do something good for me. That's its
Mm-hmm.
natural response. That's how it was built to deal with this thing.
Oh,
I let
not
it
me. Okay.
I let it be. Okay, you know, go ahead if I can take it, right? Because sometimes I get these horrible headaches with the fever. I can't
Yeah.
take it anymore,
Yeah,
right?
depends of the body aches. If it's really a fever is good
Right.
thing, but sometimes it comes with the severe body aches, then you really have to stop it
So
because
it
it's
just depends.
overreaction of the
But again,
system.
right? Just knowing your body. If I know
Yes.
my body and I trust myself in taking care of my body, so I say, okay,
Yes.
I can take it, I will just let it be. So that's my take
Mm-hmm.
on aging, the same thing, right? If I can take it, if I can take my hot flashes, that they're not killing me, that they're not making me quit my job, you know, things like that, I don't
Yeah.
have to take hormones. Like if
Mm-hmm.
it's the same with that. So as I'm aging, yes, we're all gonna age, we're all gonna die unless they you know invent something, which I doubt that in our lifetime they'll invent something that will prolong our life twice and three times. Even for Brian Johnson, I'm sorry, but for him, he can be hit by a car, all he knows, tomorrow. As for
That could happen unless he's not driving, doesn't leave the house. But then the ceiling can crash, right? You never know.
yeah,
Then
you never know, things
But
can happen. So that's why
yeah.
that's why I really don't you know, like, live your life and be yourself, make your own decisions to the best of your ability. If at 60 years old I look like crap, it's my fault, okay? That's pretty much.
But that's why I'm so strongly like
I
believe
don't want to look like crap.
at least to support your liver and like at least to support your detoxification system, you know. That's why I try at least once a week. I go to hot yoga, although it's very like energy consuming practice, but it's like a way of my detoxification. So I believe even to age of 60, if you like were constantly like flushing the system, you know, it's like a toilet. When you leave for vacation and use it for 3 weeks, then you come home and it looks like yellow, although it was not used even, right? Just because of the stagnation. So you have constantly like flush your system, detox to be able to not show such severe symptoms like because they build up over time, talking about even like menopause, aging, whatever it
Mm-hmm.
comes with that. So that's why, like, to me, there are a few supplements that I like I believe in their long term efficacy, but I totally like I think overkill what Brian Johnson does. And I don't. I'm very curious to see how it will all unfold because it's like to me it is also such a severe OCD, and it has nothing to do with happiness, in my opinion. And it, like what I love about Chinese medicine, like again, one of the result what I always aim to achieve. Sometimes I'm very successful, sometimes I'm less, but I always want to bring some sort of happiness, you know, no matter how you come when you feel like how you feel when you come to the appointment. I would do my best to that you would leave the practice feeling way more happy, you know, because like spirit plays an important role in all the regulations of like of your systems in your body. And to be so obsessed with this like specific numbers and results and tests, and like it's the short way to unhappiness, in my opinion, because it's so easily to be distorted, you know.
Imagine if
Yeah.
everyone was like Brian Johnson, his life was like that. Everyone would be just sitting in their houses counting their like vitamin supplements, pills, and their calories and their
Yeah.
wherever the markers
Mm.
are for their blood, and no one would
No.
ever even communicate because you don't have time for that. You're too busy with your test results. But I mean, seriously, we girls, we talked for an hour, and but I have one more question, one more supplements from Brian Johnson, and we'll wrap it up. It's also very, very not controversial, but people talk a lot about it, almost like about NAD. It's creatinine, and people right
Creatine,
now.
creatine.
Creatinine. It's a
Yes,
different. It's a
creatine.
different right here. It's a second one.
I
So
take it.
creatine
I
for
take
brain,
it.
oh, here you go, for
I
brain
take it.
health, for muscle health. So what do you take it for? If you take it, and Nadia also want your opinion about creatine, and yeah.
Let Nadia talk, please. Yeah, Nadia, could you please?
I actually don't really have a strong opinion on that. The only thing with me is that I usually tell my patients don't like be fanatic about like in Russian it sounds better, but like don't overdo it basically. You know, if your kidneys are healthy, if your liver is healthy, majority of the supplements are fine. Unless you're taking the whole bottle and like taking it
Uh-huh.
a whole bottle a day, right? Again, I don't have anything against it. I don't really recommend it to my patients to be taken
Mm-hmm.
like a supplement, you know, even if they you know, for something specific, I don't really recommend to take it. But if they are taking it, again, if their kidney function is fine, if their liver function is fine, and they're taking the normal daily dose, they're not exceeding it by a horrible amount. I don't really have a, I don't have anything against it. Let's just say that.
Mm-hmm. Okay, why are you taking it? Why do you take it,
So,
Nadia?
why I want Nadia to start just because she's like representing the Western like side of
Right.
spectrum.
Right.
And creatine is one of the most researched Western like supplements. Has million like researches on that, and they most of them they were all like positive. And I'm very obsessed with brain. As a chess player
Right.
since early age, I'm so obsessed. And that's another topic I really would love to discuss, but not today because it's magnesium. Because magnesium is like second thing that I think is good for everyone, just because magnesium plays a role in so many chemical reactions in the body. But creatine, like I take it for cognitive. Yes, it's been proven
Mm-hmm.
that if you take it again, like totally agree with Nadia, you need to make sure you again, and that's why you have to take care of your detoxification systems, which is liver and kidneys. So if they both function normal, you don't have any symptoms, and your lab work is good. And again, normal dosage, don't overdo it. Like I'm taking it I really want to stay sharp and have no Alzheimer's and dementia. And it's been really proven results that they reduce your like any chances of developing dementia and Alzheimer's in the long run. So reduces these statistics like numbers big. So and dementia is now being so like getting so younger, and it's like so epidemic. It's like a lot of people developing it early
Oh
and
yeah.
early on, and that's why I do so much. I try to drive different routes. Like create different some rituals to just always like rewire new pathways in my brain. I just don't want to get this dementia.
Yeah.
And
That's
that's why.
Yeah, no, that's very interesting, and that's why I'm happy that without my medical education, can also insert my 2 cents into it, because I watched, a lot of like a few podcasts, not a lot of, but a few podcasts about creatine in specifically, and about the dosage and how you should go about it, and what exactly it affects. What effect it has on your body, in particular on your brain. That's why I got very interested in it, because I think we're a little bit all obsessed about it, because no one wants, even if you age gracefully, you don't want to age gracefully here. You want to keep it up and running and be very sharp.
Yes.
So this
Mhm.
is one of the things creatine is really affects, and it's certain grams, and people have to study for themselves, because it's not something that any medical doctor will recommend you for to keep your
Mhm.
brain working. They will recommend you a medication that was researched and FDA approved, but not creatine, and
Mhm.
that showed great results for a lot of people in terms of keeping your brain working. Not maybe like not your 20, but just as keeping up with not aging too fast. So but I think at the end of it, if of it all for today, and I think we all have so much to say more, and we'll be ready for another conversation in the future. But right now, I have to say that there's so many things that it's probably impossible, right, to discuss all of them. But people have to do their own research, and none of the things that we mentioned today is a recommendation. You always should talk to a medical Western doctor before you take anything, right? That's
No, you don't have to talk to a Western doctor. You can take it with whoever is treating you, whoever is your treating physician.
but
Yes.
yes, but probably talk even to to anyone. Talk to like you go to the doctor. You talk to Nadia, and who will look at your labs
Yes,
and tell you
totally.
what you need to do, but not decide for like, oh, we told you to take creatine, and you go ahead and take it, right? We're not
And
responsible for that.
that's why, for me, when I get my license, my life becomes so much easier because now, like, anyone approaches me, oh, like, should I be doing that? Should I be doing that? I'm like, make an appointment and then I will be responsible. Other than that, not, I can only talk about myself, about like some general topic, but I totally cannot recommend anyone unless he comes to my practice, sign the consent, and then I'm responsible, and then I'm giving you medical advice. But
Right.
other than that, different story.
But today we give some free information for just
To
consideration and
research,
for thoughts.
exactly,
Yeah,
exactly.
food
To
for
do
thoughts.
your own research,
Yeah.
do your research, and and ask questions when you come to the appointment to your doctor or any provider whom you trust. Ask questions and ask meaningful questions. To pull the information out of them and do your own judgment. That's a general recommendation.
Yeah. Right, Night, what do you think?
That sounds great. Yeah, definitely. Because again, everybody's different. Not everybody's the same. There's no cookie cutter recipe for individual health. It should be done on an individual basis. Definitely.
Awesome. Okay, guys. Thank you so much, Tatiana.
Thank
Thank you so much
you.
for coming today for
Thank you,
the
Nadia, Natasha. Thank you.
yeah. And guys, stay healthy, and we're going to see you next time.
Bye.
Bye bye.